Here we have the nipple areola complex already thinned to the dermal level and spread over a moist non-adherent surface. We use a 6mm dermal punch to downsize the native nipple, starting at one of its borders. Then we check if the remaining nipple area is of appropriate size. Notice that the original thickness of the native nipple was preserved when the complex was thinned. This is important for achieving the desired projection of the reconstructed nipple. In this case, the remaining nipple area was deemed still too large, so another punch was made. Checking once again, and this time the nipple footprint appears to be of appropriate size. Next, we pick up the nipple areola complex off the table. Then turn the complex with its dermal side up, oriented so that the future nipple is towards the surgeon, and laid over a finger. Notice that there is some residual thickness at the edges of the punch excision, as the native nipple was wider than 6mm. Using sharp scissors, we debulk these edges down to the same thickness of the surrounding dermis, while preserving the original thickness of the tissues in the area of the new nipple. The nipple areola complex is once again placed over a moist, non-adherent dressing. We inspect the new nipple one last time, making sure that its footprint and projection are as desired. Then closure of the resection defect is carried out with 5-0-chromic interrupted sutures. Notice that the approximated edges have the same thickness of the surrounding areolar skin, while the reconstructed nipple is nicely projected. We use a 20mm areolatome to mark the new areola. We center it over the nipple and apply gentle pressure to mark the underlying tissue without damaging it. We then remove the areolatome and inspect the marking. Once we confirm that the nipple is perfectly centered, we replace the areolatome and this time press firmly against the table. It would be nice if the areolatome actually cut the areola, but it does not. So we use a thin blade to cut the areola. If held obliquely, the curvature of the blade matches the curvature of the 20mm circle. We press the knife down and use the forceps to separate the tissues. And here is the final product, a male-appearing nipple areola complex.